Hand hygiene for the healthcare worker. The learning objectives of this video are: 1. The learner will be able to state the primary reason for practicing good hand hygiene. 2. The learner will be able to describe at least 3 scenarios to use good hand hygiene. And 3. The learner will be able to differentiate when to use soap and water versus hand sanitizer. Hand washing or hand hygiene is the #1 way to prevent the spread of pathogens in the hospital setting. According to the Centers for Disease Control, over 700,000 U.S. patients get infections while hospitalized. Healthcare providers should practice hand hygiene to disrupt the transmission of microorganisms to the patient. Hand hygiene should be used when hands are visibly dirty and after toileting. In addition, it should be used before any patient contact, after contact with blood and body fluids or contaminated surfaces, before any invasive procedures, and after removing gloves. Please note that wearing gloves alone is not enough to prevent the transmission of pathogens within the acute care setting. Now, what is the proper way for the healthcare worker to wash their hands? Here are the steps using soap and water. Step 1. Wet hands and apply soap. A quarter-size amount of soap in the palm of the hands is usually adequate. Rub palms together until you work up a lather. Step 2. Rub each palm over the back of the other hand. Step 3. Rub between your fingers on each hand. Step 4. Rub your hands with the fingers together. Step 5. Rub around each of your thumbs. And step 6. Rub in circles on your palm and then rinse and dry your hands. In addition to the previous stated reasons, washing with soap and water is mandated when caring for patients with a positive diagnosis of C. difficile. Now, let's go on to hand cleansing using an alcohol-based product. Step 1. Apply 1 squirt or a quarter-sized amount of the alcohol-based product into the palm of one hand. Rub hands together, including the backs and in between your fingers of each hand for about 15 seconds or until the solution is completely dissolved. Alcohol-based products are effective for hand sanitation. However, alcohol does not kill the spores of C. difficile and should not be used in those situations. Also, hand sanitizer should not be used when hands are visibly dirty or after toilet use. Now, let's review what we've learned. Hand hygiene is the #1 defense against spreading pathogens in the hospital setting. Healthcare workers must wash their hands before patient contact, after contact with blood or body fluids or contaminated surfaces, before any invasive procedures, and after removing gloves. Once again, please note that wearing gloves alone is not enough to prevent the transmission of pathogens. Soap and water or hand sanitizer may be used. However, soap and water must be used when hands are visibly dirty, after toileting, after contact with blood or body fluids, or if the patient has a positive diagnosis of C. difficile. Healthcare workers can greatly decrease the incidence of hospital-acquired infections by adhering to strict hand hygiene protocol in the hospital setting. Thank you.